A meningioma is a tumor that arises from the membranes that cover the brain and the spinal cord. Typically, they are benign growths, so they're not cancerous, but can occasionally be more aggressive. Very rarely, they can be cancerous, but these tend to happen more commonly in patients with specific genetic conditions. We cannot really talk about causes when it comes to meningiomas, as they usually result from a combination of multiple factors rather than from a single cause. It is conceivable that hormones play a role in it, as this tumor is more common in women, but this link is not yet fully understood. Exposure to high doses of radiation and the presence of underlying genetic conditions like neurofibromatosis type 2 are well-recognized risk factors for meningiomas, although they represent a minority of the meningiomas we see. A growing number of meningiomas are picked up on brain scans obtained for unrelated reasons and before they even cause symptoms, for example, after patients had a fall or an accident. But patients with meningiomas can also experience a multiplicity of symptoms, either alone or in combination, which include headaches, epileptic fits like seizures, changes in behavior or in memory, weakness or altered sensation in the arms or legs, facial droop, double or blurred vision, among many others. There are no specific symptoms for meningiomas, and they can vary according to the location, size, and amount of swelling that they incite in the brain. As a rule, meningiomas that cause significant symptoms or have shown evidence of growth on serial imaging, or finally have features that may suggest a more aggressive nature or behavior, may need to be removed. The surgery to remove or reduce the size of the tumor is usually recommended for the tumors I've just mentioned. Gamma knife is an alternative option and can be the preferred treatment for some patients and meningiomas in order to prevent tumor growth. Sometimes observation alone with regular imaging surveillance is all that is required to manage the meningioma. There is no medication available yet that effectively treat these tumors, but there is a number of different medications that can help controlling the symptoms, such as headaches, seizures, or brain swelling. In some circumstances, a combination of these and other modalities may be necessary. Gamma knife is actually a misnomer, as it does not involve any cutting or even a knife. It is a minimally invasive procedure where gamma rays are delivered selectively to the meningioma with minimal spill to the surrounding brain. It may sound nonsensical to treat tumors that can be induced by radiation with radiation, but the high dose of radiation is delivered to the unhealthy tissue within the tumor with minimal radiation reaching healthy tissues. This is usually done as a day case and as a single treatment. The treatment time can vary between a few minutes to a few hours, but be prepared to be admitted before treatment just to have all the investigations that are necessary in preparation for the treatment. It is usually very well tolerated, but the most common symptoms patients experience on the day are headaches, dizziness, and lightheadedness. This is usually well-controlled medication. At a later stage, patients can develop hair loss, which is usually temporary, and also brain swelling, which is also generally transient and can be managed with medication. Long-term side effects are rare, but may include radionecrosis and radiation-induced tumors, which is exceedingly rare. Surgery, on the other hand, has the advantage of being potentially curative. At the same time, it is also the most invasive option and requires a general anesthetics. Surgery has the advantage of being potentially curative, but at the same time, it is also the most invasive of the options and require general anesthetics. Usually the operations go to planned and there are no major side effects aside from wound pain and swelling, which is common to most operations. However, it does carry a small risk of life-changing complication or death. The serious risks are generally infrequent, but the figures vary depending on the complexity of the tumor. Meningiomas can be complex tumors and they generally require long-term imaging follow-up irrespective of the management option. But the positive aspect of it is that they are frequently curable or controllable with appropriate management. And in such cases, patients should be able to live a normal life and with a full life expectancy.